Hello, my name is Alexis Logan and I'm a student at Missouri State University. My presentation topic that I will be discussing today is child neglect causes and cures. So what is child neglect? Well, child neglect is a form of child abuse that occurs when a parent or caregiver fails to provide the basic needs of a child. These basic needs include food, shelter, clothing, medical care, supervision, affection, and support. Child neglect can result in physical or psychological harm to the child or threaten their health, safety, and well-being. The types of child neglect include physical neglect, emotional neglect, medical neglect, and/or educational neglect. Physical neglect examples include deserting a child or refusing to take custody of a child who's under your care, reportedly leaving a child in another's custody for days or weeks at a time, failing to provide enough healthy food and drink, failing to provide clothes that are appropriate to the weather, failing to ensure adequate personal hygiene, not supervising a child appropriately, leaving the child with an inappropriate caregiver, and exposing a child to unsafe and unsanitary environments or situations. Children need enough care to be healthy and enough supervision to be safe. Adults that care for children must provide clothing, food, and drink. A child also needs to be safe and have healthy shelter and adequate supervision. Emotional neglect examples include ignoring a child's need for attention, affection, and emotional support, exposing a child to extreme or frequent violence, especially domestic violence, permitting a child to use drugs, use alcohol, or engage in crime, and keeping a child isolated from friends and loved ones. Children require enough affection and attention to feel loved and supported. If a child shows signs of psychological illness, it must be treated. Medical neglect examples include not taking a child to a hospital or appropriate medical professional for serious illnesses or injuries, keeping a child from getting needed treatment, not providing preventative medical and dental care, and failing to follow medical recommendations for a child. Some states do not prosecute parents who withhold certain types of medical care for religious reasons, but they may get a court order to protect the child's life. Parents and caregivers must provide children with appropriate treatment for injuries and illness. They must also provide basic preventative care to make sure their child stays safe and healthy. Educational neglect examples include allowing a child to miss too much school, not enrolling a child in school, or not providing comparable home-based education, and keeping a child from needed special education services. Parents and schools share responsibility for making sure children have access to opportunities for academic success. These are some signs of child neglect in a child. The signs include clothing that is in the wrong size, in disrepair, dirty, or not right for the weather, and they're often hungry, stockpiles food, seeks food, may even show signs of malnutrition like distended belly or protruding bones. They have very low body weight and height for age. They're often tired, sleepy, listless. They have hygiene problems, body odor, talks about caring for younger siblings, not having a caregiver at home, untreated medical and dental problems, incomplete immunizations, truancy, frequently incomplete homework, and frequent changes of school. While a single indicator may not be cause for alarm, children who are neglected often show that they need help in a variety of ways. This slide covers some child neglect demographics. Neglect is the most common of all types of maltreatment, and it affects 78.3% of all cases of maltreatment. It usually involves the whole family, which means all the children in the household suffer, and children 0 to 3 years old are most likely to be neglected, and most victims of child neglect are under the age of 7. There are several factors that can lead to child neglect. Some of the most common causes include poverty, domestic violence, substance abuse, mental health disorders, unemployment, and unplanned pregnancy. In some cases, parents who are victims of child abuse or neglect themselves may consider neglect as normal and repeat the cycle with their own children. Treatment can help both children and parents in abuse situations. The first priority is ensuring the safety and protection for children who have been abused. Ongoing treatment focuses on preventing future abuse and reducing the long-term psychological and physical consequences of abuse. Talking with a mental health professional can help a child who has been abused learn to trust again, teach a child about healthy behavior and relationships, and teach a child conflict management and boost self-esteem. Several different types of therapy may be effective, such as the trauma-focused cognitive behavioral therapy. The trauma-focused cognitive behavioral therapy helps a child who has been abused to better manage distressing feelings and to deal with trauma-related memories. Another type of therapy, child-parent psychotherapy, focuses on improving the parent-child relationship and on building a stronger attachment between the two. If you need help because you think someone else has been abused or neglected a child, take action immediately. You can start by contacting your healthcare provider, a local child welfare agency, the police department, or a child abuse hotline. These are 3 empirical articles that give solutions to child neglect. The first one by Bjorn and Doris indicates that the largest part of child neglect occurs in the home at the hands of the parents or caregiver, and in order to take protective measures in an effective manner, there is a need to develop instruments for measuring risk factors. The second empirical article by Ziana and Humphreys shows that clinicians need to understand the different cultures of the legal and child protective services systems. This will help them advocate more effectively for maltreated children's best interests. And the third and final empirical article by Jin suggests that primary care clinicians, such as pediatricians, can identify high-risk families and provide or refer for interventions when appropriate. Examples of interventions that may prevent child maltreatment include referral to community resources, parent education to increase use of positive discipline strategies, and behavioral therapy for parents to improve coping skills and strengthen the parent-child relationship. And home visitation programs are also another commonly used approach. In conclusion, child neglect and maltreatment leads to an increased risk of different disorders, academic problems, delinquency, and difficulties in social relationships. We as society need to strengthen economic supports to families, change social norms to support parents and positive parenting, provide quality care and education early in life, enhance parenting skills to promote healthy child development, and intervene to lessen harms and prevent future risk. These are all my references for my presentation. Thank you so much for watching.